Well, hello everyone. This is Deidre Kendrick, your nurse advocate, here on Health Chats Among Friends. Tonight, I have the pleasure of speaking with a good friend of mine, Jeremy King. And Jeremy is the health insurance nerd. So, we're going to find out more about him, about what he does. And hi, Jeremy, how are you?
I'm doing great. Thanks for having me on.
Oh, thank you for being here. Thank you for being here. So, tell us a little bit about yourself and what some of the services that you are providing for the community.
I am a life and health broker in Texas and a few other states. And what I do is I, build plans or just get people enrolled in plans that, protect against what they need, whether it's they need to see certain doctors or, their conditions, or they just need protection against accidents or critical illnesses. You just want to go in and protect people against, sicknesses, illnesses, and then also the what could be devastating financial consequences from those.
Wow. So, I didn't know you were licensed in more than just one state.
Yeah, eight states right now. I've got some friends that keep giving me business, so like I keep having to get new licenses.
Oh, that's amazing. Okay, great. Good for you.
Yeah.
So, health insurance is such a key element in the healthcare arena. So, I love that Jeremy is the type of advisor that will sit with you and talk with you and find out about your gaps, your needs. So, Jeremy, tell me a story about maybe one of the persons that you've helped.
There's one lady. She is getting close to Medicare age. She's not there yet, but in January, she's going to be going into the Medicare system. So it's for people that are in their late 50s, early 60s. It's the prices for healthcare have gone up so much, and so she'd had a plan for a long time, so long that she had one of those little coupon books that she would go in and write in the amount she's going to pay
Wow.
every year. And she'd been on that for years and years. And finally, it got to the point where she'd already retired. And it got to the point where she just couldn't afford the premium anymore because every year it went up and up and up. So I went in and we saw what was important to her and what wasn't. And we have her on a plan right now where we took her deductible from like I think it was $4,500 to where if she's in an accident, she has an accidental injury, like she falls down, breaks an arm or something like that, her deductible is only $250. And then if she does have a critical illness, she gets cancer, has a stroke, heart attack, something along those very critical, very serious illnesses, she actually doesn't have a deductible when you tie it into the policy that I wrote for her. So I did all that, and she's saving $230 a month, which it's a lot of money, especially for a senior on a fixed income. So
Right.
it's just really looking at what she needed and making sure that that's taken care of.
That's awesome. I mean, I just love that story. That's I'm at a loss for words because it's such a big difference from when I was working for a company and then they have open enrollment and they bring you all into their room and they say this plan, this is this plan, this is how much it costs, and then you choose and get back to work.
Yeah.
So you're a different type of service. It's more personalized. It's more caring. It's more thoughtful and insightful too.
Yeah, I try to be. And when I think about like my old corporate jobs, it was just really the HR people putting out a plan and just if only three people complain, like that's a big win if they've got a lot of people. But you know, if, if they don't have that kind of customization, then it's really hard to do the right thing for people. And then they're not licensed. They don't. This isn't something they do. And the people that are licensed and do talk to them about the policies, they're not there to talk to the people that are getting the policies. So it's definitely something that I feel sets me apart.
I love it because you said customization. So sitting down with someone and finding out what their expectations are, where their needs are, and where the gaps are, that's key. That
And
makes,
super important, super
yes,
important.
yes. So why do you call yourself the insurance nerd?
I'm a nerdy type of guy. And I like to go in and just really kind of take things apart and see like where this is, where, you know, part A is better, where part B is better. You know, once you get down to kind of figuring out, like I've got 65, I think, insurance companies that I'm contracted with, and you know, every year I'm just bringing on a few more here, a few more there, just to make sure that I have the best options. You know, so if somebody, you know, whether if they want to have a company that has a really robust offering and they want to get one bill, you can get that taken care of. Or if they just really want the best service and the best price, then you can go and shop it out to all these different companies. You know, I'm more, it's not like I'm married to a company, you know, I'm more putting the companies in a death match for people services, and more like I'm, you know, married to the customer and making sure that they're getting what they need.
I love that. I love that. So I'm going to ask a silly question here. So open enrollment is going to be when?
So there are two kind of open enrollment periods starting. So Medicare open enrollment, enrolling in that can start on the 15th of October, and then that lasts all the way to December 7th. And then there's the ACA, the Affordable Care Act, or Obamacare open enrollment, and that starts on November 1st and goes all the way to December 15th. So
Okay.
those are the open enrollment last year got extended a little bit, and we might see that with the coronavirus affecting people being able to, you know, like the people that were wanting to get face-to-face meetings, it's not nearly as much of as an option as it used to be. So you know, we might see those periods lengthened again.
Right, right. Do you find that a lot of people had to drop their insurance plans because of COVID?
Yeah, it happened. And there's dropping of plans. There were people, and dropping a plan during a pandemic is just, it's such a kind of such a tragic, you know, course of events. A lot of people had to rearrange their coverage to where it was a much more bare bones of a plan, to where we're still preventing them from, if something terrible happened, you know, keeping them away from, you know, 250,000, $500,000 loss in terms of their financial future. We're still able to, you know, protect people against stuff like that. But it did hit a lot of people, especially self-employed people, really hard.
Oh yeah, tell me about it.
Yeah.
Yeah. So, is there anything new or special coming out down the pipe with insurance?
I mean, everyone's tweaking products. You know, Medicare has been around for a while. The Affordable Care Act's been around for a while, and there's a lot of show and a lot of bluster about, you know, making some big changes, but really everybody's just kind of, you know, just kind of sitting where they are, trying to make things better where they can, and you know, just working on the little things.
Right. So you say you have 65 plans that you are affiliated with?
65 companies, and each one of those has, you know, multiple plans. Like some of them might have, you know, like 3 or 4, but a lot of them will have, you know, 15, 20, 40, you know. It's
Wow.
There's a lot out there.
How in the world do you keep up?
um it takes a while. It takes a while to figure it all out. But I have a few cheat sheets. Actually, I have an Excel spreadsheet of cheat sheets to help me with all the different products out there, just to make sure that if I go with so and so company, I have these dental plans taken care of. And if they have, you know, one company has a lot of dental plans, also they have a lot of senior dental plans, so they have two separate spreadsheets just for that, just so I can look at it and think to myself, okay, this person's only going to be on this plan for 6 months. There's a 6-month waiting period for major dental stuff like crowns and root canals. You know, that's not going to be needed in their plan. So we can save a good $10-15 a person by getting them something that's just going to take care of the preventative and their basic, and then they can also have all that available to them at the start of the plan. You know, so I've gotten to where I have everything kind of figured out in terms of looking through that, but taking good notes in terms of what companies offer is really helped me out, and really makes things a lot easier for when I find out what's important to them, and, you know, we can start looking at options.
Yeah, so that's why I love advisors such as yourself, because it's about that doing an assessment to see where that gap is instead of just throwing these three plans at someone and saying, okay, well, this is your choice. And you really,
Yeah.
people are lost. I mean, I know I was when I was having to work for somebody and pick out an insurance plan. It's like, oh, which one? I look at the cost of it. And
Yeah.
so it's great that you sit down. So tell me about some of the questions you may ask when you sit down with someone.
Depending on, their situation, like their budget's always an issue. You want to see
Mm,
what they're looking for, what they, where they think the market is, where they think they are. Uh, Health conditions, if you're able to ask, because for some segments of the population, you aren't able to ask, questions about their conditions. But for the people that you can, you always want to make sure that, if they're, that what they have had in the past. And then also if there's a family member, if you want to protect them against something that a family member has had in the future, that's something important that doesn't get addressed enough.
right, right. So tell me this, because I remember when I was transitioning from working in the hospital to being a full-fledged entrepreneur, I was a little bit concerned at first by going with a health plan, something similar to what you offer. But what I found was I was paying the same premium in the hospital as I was paying for plan outside of a hospital setting or a company setting. So is that still true? Are the
You,
premiums?
it all makes so the it all makes it makes a ton of a difference when you see like how much a employer is pitching into the program. So if
Okay.
you're at an employer and they're not pitching a lot into the program, and then you have a lot of older or high risk people that are in the program, then your premiums might be higher. On the other side, if you have an owner of a company, or you work for a corporation that really wants to make sure that you stay there, they might offer some pretty rich benefits to keep your costs down and keep your access to coverage high.
Oh, wow. So what would you say to somebody who's an entrepreneur, a business owner, and they're saying, well, I just can't afford insurance?
Yeah, everyone has insurance on their most important things. If you uh, There are ways to protect somebody, whether or not they need a doctor visit, or if they just need help in case there's a huge bill that's about to happen for them. And if someone really can't afford that kind of coverage right now, if you look at your income, you might be eligible for a subsidy from the government to help with the Affordable Care Act. You can get advanced premium tax credit, which is kind of taking money from your next year's tax return to help with the current tax return. And that's not like, you know uh, that's not really like what it is, but that's as close as I can get as not being a tax professional.
Right,
Is
right.
money you'll be due later if you
Yeah.
make more than you think you do. But that's just saying, if you're a starting entrepreneur, and you're getting through those first couple of years where you're trying to figure everything out and trying to make your business work, trying to get your clients happy, and you're spending a lot of money and you're making maybe not as much as you want, there are a lot of options out there for government help.
That's awesome. I did not know that. So that's great. You are just such a book of knowledge.
Well, thank you, thank you, thank you.
Well, if anyone had any questions to ask you or to get some more information about some of the new programs or policies that are out there, how would you like someone to get in touch with you?
You can always reach me on the phone at 817-714-7231. Also, you can find me on Facebook. I'm the Health Insurance Nerd. If you want something that's really easy to remember, uh, those are really how I see most people. You can email me at thehealthinsurancenerd@gmail.com. That's another way. But really, just a phone call is kind of the best way to get a hold of me, or a text to see like if there's a time available.
Okay, repeat that number again for us.
817-714-7231.
Wonderful. Jeremy, thank you for your time. This has been
Thank you,
a
Deidre.
great chat. I look forward to having you back once, I guess, when open enrollment is kind of dwindling down, because I know you're going to be busy.
Man, we're preparing for it. This is it's going to be an
Yeah.
election year, so we think that
Yeah.
everyone's going to push it back until like they're like, oh man, I have to get this done. So
Yeah.
thanks for having me on early.
Well, awesome, awesome. Well, thank you again. So I got to chat with the health insurance nerd. Be jealous, everybody. Well, thank you for your time again. And my name is Deidre Kindred. I am a nurse advocate, educator, and navigator. I love helping you navigate the complicated healthcare system by providing resources such as my wonderful friend here, Jeremy King, the health insurance nerd. Thank you guys.
Have a great night.